Man, you're watching iWITNESS, the Print's daily live feature covering the coronavirus pandemic. I'm Jyoti Malhotra in Delhi, and today we have with me Fatima Khan and Nirmal Poddar. They are in Uttar Pradesh. You can see Fatima and Nirmal. If you just move a little bit, I can show our viewers the Yamuna behind. So they are somewhere between. They are in Hamirpur district between Agra and Jhansi, and this is Hamirpur district. Fatima, tell me exactly where you are and why are you on the banks of the Yamuna? What's going on?
Right, Jyoti, we are here right now, the Ghat of Yamuna River. It is here that a couple of days ago, some news and some viral images started emerging of peculiar bodies floating on the surface of Yamuna. Later, when the local villagers probed, they realized that these are dead bodies that are floating in Yamuna. And subsequently, people started spotting more and more of these bodies every day. By the day, more bodies floating here. But people didn't know why is this happening. Of course, people assume this is because of coronavirus and the spike, the almost crazy spike in the level in the deaths and the cases in Uttar Pradesh and other parts of the country. But earlier too, here when people would die, people would cremate the body as per the religious norms of the Hindu religion. But suddenly people started dumping the bodies in the river. So we are here, Nirmal and I, to sort of probe why has this been happening in the last couple of days.
Right. So tell me, Fatima and Nirmal, have you been able to speak to the authorities? What are they saying?
So the authorities so far maintain that this is just an aberration, that this is not something that will continue to be a norm, even though this has been for the last 6-7 days, as per locals and villagers here. But they say that, this is just people, they don't know what to do with the body, and so they just dump it. Of course,
They
there
don't know
are.
what to do. Sorry to interrupt. They don't know who doesn't know what to do. The villagers don't know what
So
to do. The authorities don't know what to do. What is it?
so that yeah so it's mostly the families. The if a person from a poor background is infected with coronavirus, there are layers of issues and problems attached. For once, okay, if they die, if we have to cremate them, then they'll have to go and arrange wood stake lakdi, which as you know is an expensive expenditure. So for a lot of joint families where they are seeing recurring deaths one after the other, they realize that this is too much of an expenditure for us, and so they just decide to dump the body. Another reason that we realized after speaking to people here is that it's not just poverty, but it's also the sense of stigma almost attached. They know that if we for one element is them being too careful, that okay, if we touch the body too much, if too many people are called, then it might just lead to us getting infected. The other element also is there are people who are skeptical that okay, if we actually cremate the body, there will be a huge crowd and everyone will realize that a person in our family had coronavirus. And even though it's been well over a year since the pandemic entered our lives, the stigma around the virus continues to destroy families and lives. And so here as well, they're like, okay, we have to be extra careful, extra cautious. We don't want to announce to the world that someone in our family died of coronavirus. And so they just end up dumping the body. It's like a hush hush affair. And so, of course, poverty coupled with helplessness, coupled with these social stigmas, is what is leading to this so far as well. We've been able to learn.
Right. So viewers, please do send in your questions. Fatima and Nirmal are here for the next 20 minutes to half an hour to answer your questions. Nirmal, can you tell me a little bit about the scene at the back? You're on the ghats of you're on the banks of the Yamuna, like you just said. Can you describe to me कि आपके पीछे क्या हो रहा है? What? Just explain to me. What do you see at the back?
Like when we came here, we spoke to the nearby people, and they told us that few days back the amount of bodies that were flowing in the river were more, but today it's less. But then too, there are more than 5 bodies now floating in the river, and the authorities they are just as we can see the bridge over here, they are just crossing
Yeah.
by, they are seeing the bodies, but they are not doing, like, they are not processing the situation, and they are not coming here to take down the bodies. So and also the nearby people also they told us that because of this, like, the dogs are coming, they are snatching the body and they are eating the body. So these kind of scenario are all over here in this ghat. So that's it for now.
No, but explain to me, Nirmal. You said that there are 5 bodies floating today. Can you see them? Did you see them?
Yes, we can see them. They are in the middle of the, like, they are in the middle of the river, and we can see them?
We can spot them from a distance, Jyoti. We've been trying to get closer and closer to it to get a more accurate image of it. We haven't been able to so far, but we'll definitely keep trying to get an image. But the villagers here point us to them, and so from a distance we can spot that there is something floating atop that looks like a body.
Fatima, apart from the stigma that is attached to somebody that may or may not be infected with COVID, the villagers don't know that these people who have died have been infected or not been infected. So when you talk to them, what happened? What is the, what do they describe happened? Ki suddenly bukhar ho gaya, suddenly zukam ho gaya, fever ho gaya. What do they say to you?
Right. So, Jyoti, as we all know now, the symptoms of COVID are just so commonplace. These are symptoms that you can associate with almost every other disease. And so, for someone who comes from a poor social-economic background, for them to know for sure that this is COVID, in fact, is something that they can't afford.
Let me interrupt you. Sorry, Fatima, let me interrupt you, because you said earlier also that poor people, to cremate somebody, they need to buy wood. उनके पास पैसे नहीं होते लकड़ी खरीदने के लिए. But they do that, isn't it? So
yes.
Why is it that in this situation, जब उनको पता भी नहीं है कि ये कोविड है या नहीं है, तो फिर भी वो लकड़ी क्यों नहीं खरीद रहे और उनको अच्छी तरीके से क्यों नहीं क्रिमेट कर रहे?
So I think here also another factor is the paucity of wood, the lack of wood. This place, like almost every other place, you've seen reports from Delhi, other parts of UP, is running out of wood because there are so many cremations every day. And so because they're running out of wood, whatever wood they're getting is also at a much higher price because of the supply-demand difference. But so far, the people we've spoken to, they're saying this wood is not available. And for us to go around, do all this hatapari to kind of arrange wood is something that we just cannot afford at this point. And so this just seems like an easier solution when there is no wood available. If the wood is available,
yeah, that's fine. लेकिन निर्मल, आप मुझे ये बताइए कि अगर आप लोगों ने किसी गांव वालों से बात की, तो आमतौर पे तो ये क्रिमेट करते हैं अपने फैमिली मेंबर्स को, जो खत्म हो जाता है. तो आज की तारीख में अगर लकड़ी नहीं भी है, तो ये क्या मतलब बीच रात में अपने वो दफना दे, मतलब क्या करते हैं कि पानी के अंदर?
Actually, हम लोगों ने जब गांव वालों से बात किया तो हमें एक और छोटी सी बात पता चली हमें कि there's a term पाचक. तो उस टर्म के बाद
टर्म क्या है?
टर्म पाचक. तो उन्होंने ये बताया कि इसमें जो अनमैरिड जो लोग होते हैं उनको उनकी अगर डेथ होती है तो ये लोग जलाते नहीं है, ये लोग पानी में बहा देते हैं. तो दिस इज ऑल्सो वन ऑफ द रीजंस कि ये लोग पानी में लाशें बहा दी जाती है यहाँ पे.
But Pachak comes every year, so this is something that happens every year. But right now, what it seems like is that the Pachak period overlapped with this COVID spike, and that resulted in more people dumping the bodies.
So explain to me, if I understand you correctly, there is a period in the duration of that. If somebody passes away, then his or her body is not cremated, but it's floated. It's put immersed in the river. Is that correct?
If he and she is unmarried, then
yes.
If she or she is unmarried, और इस पीरियड के अंदर, इस पाचक पीरियड के अंदर अगर कोई खत्म हो जाता है, किसी की मृत्यु हो जाती है, तो वो पानी में बहा देते हैं, फिर जलाते नहीं है. Is that correct?
Right.
That's what the villagers told to us.
Yes.
अच्छा, तो एक दो सवाल आए हैं आप लोग दोनों के लिए. ओमकार ये पूछ रहे हैं कि how are the authorities managing the bodies found in the river? How are they disposing them of?
So far, they aren't, is what the villagers are also complaining, at least not at the extent and level they'd want. So far, I mean, if we're still being able to spot five bodies 6 days after this news emerged, then it clearly means that there isn't due diligence that is being done. But the authorities are maintaining that, look, every day this happens, and when we do go there and we do pick up the bodies eventually, and then I mean, the idea also is that, look, there's only so much we can do when there are so many deaths happening in and around the district. So
Who is saying this, Fatima, that there is only so much we can do?
I mean, there is this general attitude of that is coming across from the authorities, but they are saying that, look, we are doing our level best. If the villagers go and dump the body, the only thing we can do is go pick it up. We can't stop them from doing so. Of course, there is this environmental concern also that.
Sorry, I'm going to stop you right then for 1 second. So just explain to me. So during this Pachak period, is it that every year, if unmarried young young or old, unmarried people, when they pass away during this Pachak period, their bodies are immersed in the river. Is that correct?
That is, yes, that is what the villagers tell us. Yes.
Right. So does this mean that the bodies that you are seeing now and that have been floating in the river for the past few days, is this happening during the Pachak period, or is it an unusual number that
It
have?
is an unusual number for sure. Some villagers, they assume that they speculate that since last week was the Pachak period, the last 4 or 5 days, so the overlap of the Pachak period with the COVID spike may have resulted into this unusually high number. But we cannot discount the fact that, of course, it is the COVID deaths that are also resulting in this, because it's just so happened that Pachak overlapped with it.
तो अच्छा निर्मल, ये बताइए, जब आप लोगों ने किसी अथॉरिटी से बात करी तो ये क्या कह रहे हैं? ये मतलब डेफिनेटली ये नहीं बता रहे कि ये कोविड है या नहीं है, या ये नॉर्मल डेथ बता रहे हैं, कि क्या कह रहे हैं?
एक्चुअली जो अथॉरिटीज ऊपर वहाँ ब्रिज पे से वो लोग देख रहे हैं, वो देख रहे हैं कि नीचे क्या चीजें चल रही है, कौन से मीडिया हाउसेज आ रहे हैं यहाँ कवर करने को, तो वो लोग ये सारी चीजें देख रहे हैं, तो वो बात करते हैं, बट वो कुछ बता नहीं रहे हैं, वैसी चीजें हैं। तो जो विलेजर्स है उन्होंने ये बताया कि अथॉरिटीज आ रहे हैं, बट वो कुछ इक्विपमेंट लेके नहीं आ रहे कि वो लाशों को निकाल पाए या उनको जो उनकी अंतिम संस्कार उनका कर पाए, वैसा कुछ चीजें वो कर नहीं रहे। यहाँ के जो लोकल फिशरमैन है उनको वो बोल रहे हैं कि आप बॉडीज निकाल दो, तो जो यहाँ के लोकलर्स है वही बॉडी निकाल रहे हैं और वही चीजों को मतलब यहाँ ठीक कर रहे हैं। अथॉरिटीज ऐसा कुछ भी चीजें मतलब कर नहीं पा रही है अभी तक।
तो वो ब्रिज के ऊपर ब्रिज के ऊपर वो आते हैं, वहां पे खड़े हो जाते हैं, लेकिन उसके बाद कोई एक्शन कुछ नहीं लिया जा रहा है।
Eventually body hatate hain wo with the help of the localites and the villagers, but they aren't proactive, let's put it like that.
So the question is, Fatima, that not only is there a pandemic, but there also is the fear that there could be a health hazard, like, if you have bodies floating in the river, then obviously, and if people are going to drink the water from that river. So have you spoken to anybody where they are thinking of this as well?
Yes, when we came here, we saw people actually jumping into the river even as dead bodies are floating around. And so we asked people, why are you doing this? Aren't you scared? And most of the people who are doing this are fishermen. Their livelihoods depend on jumping into the river and being able to procure fish and go back up. And they're saying, look, our livelihoods depend on this. How long will we wait for authorities to come and remove the body? If everyday bodies are being dumped, we cannot just abandon our job. And so they have to, in fact, the fishermen here are extremely troubled. They're saying that the water body is smelling. There is a weird odor to the body. Like Nirmal earlier mentioned, dogs are coming and chipping into the bodies. And so there is some flesh also floating around.
There was a layer of fat in the water 2 days back.
Is what the fishermen told us. And so they are also very hesitant. They're also very scared that all of this we've been doing this for 20 odd years, but suddenly this experience has become so awful for us in the last 5-6 days, but we have no option but to go about it.
So Rahul is also asking, but it's a question that you have answered already, but perhaps you can take the question. Why is the state government not taking any action despite the news that has come to light over the last several days? Do you have an answer to that, Nirmal?
State government is definitely taking action, but the amount, like, जितना उन्हें करना चाहिए उतना वो कर नहीं पा रहे हैं। वो बस इस पे उनका ज्यादा ध्यान है कि कौन लोग आ रहे हैं, कौन यहाँ पे देख रहे हैं, कितनी लाशें बह रही है, बट जो लाशें आ रही है उनको कैसे हटाया जाए, उनको उनके अंतिम संस्कार कैसे की जाए, जो लोग लाशें डाल रहे हैं उनको कैसे समझाया जाए, इस पे ध्यान थोड़ा कम है।
नहीं तो फिर क्या एक्शन ले रहे हैं? फातिमा, आर दे टेकिंग एनी? यू आर सेइंग टू मी दैट दे आर स्टैंडिंग ऑन टॉप ऑफ द ब्रिज, वो देख रहे हैं उधर और वो बता रहे हैं कि गांव वालों को बता रहे हैं, या जो फिशरमैन है उनको बता रहे हैं कि आप नदी के अंदर कूद के आप जो है लाशें निकालिए, लेकिन खुद तो कुछ नहीं कर रहे हैं ना?
Right now, no, nothing to stop this from happening.
So Gopal is asking, he has a question. What has been the public sentiment towards the government since these bodies have been found floating? What are people saying?
People are obviously very angry, as you know, multiple reports from all, a lot of us at ThePrint have been traveling to various parts of UP. People are angry. It's almost a very unprecedented, unusual kind of anger that we haven't seen against a very popular state government, a very popular party in the state, because suddenly they realize that, okay, a lot of our family members are under threat. This can happen to anyone. And there is this sense of helplessness that has come across. Just yesterday, we came from Agra, where we met an RSS worker. We met the family of an RSS worker. The RSS worker passed away. The family is furious. The worker was followed by Prime Minister Modi on Twitter, and after his passing away, this family is furious. They have torn off the poster of Prime Minister Modi from the back of his car. They're just like, okay, we really trusted Prime Minister Modi, but what did he do for us? So there is this sentiment amongst even the most fiercest supporters of the state government of Prime Minister Modi. Even these bodies, Jyoti, it is a very gory visual. It is a very grotesque, a very, very difficult visual to see, even for us, though we've just come a couple of hours ago. So for people who are working here night and day to live and survive with dead bodies floating around you, it's something that will leave a very bitter taste in your mouth.
So there is another question from Anurag, and he's saying, do you have any comments on the health infrastructure in the village? When you went into the village, did you see any primary health center? आपने देखा कोई उसमें कोई clinic, hospital कुछ था इस इलाके में?
So there are small clinics, but they are at a distance from this ghat. Also, where we are right now, it is a fairly remote region. We've come right at the ghat. So right there, if you can see the bridge behind us, that's where all the trucks pass by. You'll only see trucks. You'll not see really many regular cars, regular vehicles passing by, because it's only it's almost like it's an area that people pass by when they have to move between bigger cities. So
how far are you from Agra and how far are you from Jhansi?
We are a couple 4.5 hours away from Agra. We are like 2 or 3 hours away from Jhansi. So we're around that region. This isn't a region that many people even particularly talk about, unfortunately. But right now, because of this emergence of these dead bodies, suddenly a lot of people are paying attention to this place. And of course, the hope is of the villagers here that because of this sudden scrutiny attention, there will be some sort of development that we'll see.
But did you see, I mean, even though this place seems quite remote, but on your journey between Agra and Jhansi, you've already covered about 4 hours. Along the way, I'm sure you must have stopped in some villages. What is the state of the primary health centers? Did you go to any? Were they shut? Are they talking to people? Do you, what do you see?
There are healthcare centers, but they aren't equipped to deal with COVID. So they are dealing with other issues here and there. But there are special hospitals designated for COVID, and they are only in the bigger cities. They aren't really in these smaller villages in and around this area at all. There are some healthcare centers here and there, but the minute they feel that someone might potentially have contracted the virus, they send them off, or they say that, look, you have to go to XYZ hospital in XYZ city and get yourself treated. That is the only option that people have here.
So is there a lot of fear in the villages कि क्या हो रहा है हमको जब बुखार हो जाता है तो ये क्या हो सकता है कोविड है कोई दूसरा बुखार है how are they understanding this Nirmal?
Now because it's the second wave now और ये काफी close है village काफी close है इस जगह से तो लोगों को अब समझ में आने लगा कि ये काफी जो चीजें चल रही है काफी डरावनी है उनको मास्क पहनना चाहिए तो मास्क तो सबके पास अवेलेबल नहीं है तो वो एक यहाँ पे वो होता है गमछी होती है तो उससे वो अपना चेहरा छुपा लेते हैं या ढक लेते हैं जैसे मवेशियाँ चराते हैं तो उस समय उनको आना पड़ता है इस जगह पे बट वो काफी मतलब उन्होंने हमें रोक के भी बोला कि आप उधर जा रहे हैं तो वहाँ ध्यान से जाना वहाँ पे तो दे आर दैट मच अवेयर राइट नाउ कि हाँ कि आप जा रहे हो वहाँ तो ख्याल रखना अपना जो भी तो वैसा
Tell me a little bit about the situation in Agra, Fatima. You said, I mean, your story in the print about this RSS workers family is there, and viewers, I would encourage you to read the story. And as Fatima just described, this gentleman was followed on social media by Prime Minister Narendra Modi, but his very unfortunate passing away has led to not just to grief, but to a great deal of unhappiness that there was no help that was available. But talk to me a little bit more about the situation in Agra, Fatima.
So we went to a couple of healthcare centers, big hospitals in Agra. The biggest one there right now is SN Hospital. It is the biggest government hospital there. And then we went to a couple of private hospitals, and there was this stark contradiction that we saw, contrast that we saw between the government hospital and the private hospitals, in that the government hospital, of course, there is a lot of crowd, there are a lot of people trying to get in, etc. But there is more or less the sense of, okay, you know what, at least we know that they have oxygen and they will treat this person, and at least we know that something can be done here now. In private hospitals, there is almost this sense of lack of trust, this trust deficit that has emerged, and it's coming across also because of gross overcharging by the hospitals, private hospitals there. In fact, one hospital just yesterday was debarred by the Agra district magistrate because it charged around 9 lakh to 10 lakh rupees for a COVID patient. In fact, this patient, the RSS worker who passed away, one of the primary reasons why the family was so infuriated was, of course, that, Amit, who was the person who passed away, that he died of COVID, and that they didn't get any help from Prime Minister Modi or the establishment, but also the fact that the private hospital where they got him admitted, it charged so heavily. It charged close to 11 lakhs for Amit's treatment. And in fact, just a couple of days after Amit's passing away, unfortunately, his mother also passed away. So the family had to shoulder the burden of Amit's treatment as well as the mother's treatment, and both of them did not survive either. So they're also infuriated. There's a lot of anger towards the private establishment that, look, they're exploiting us. They know that there aren't many bigger cities around here, so we cannot do much. We know. In fact, the other issue with Agra is that a lot of people from smaller regions like Farrukhabad, Hathras, etc., they travel to Agra whenever. In fact, most of the patients we met there in the hospitals were people who weren't actually from Agra. They were from nearby areas, nearby smaller towns and districts, and so they are traveling to Agra, which is of course increasing the burden of the state of the district health infrastructure. That combined with the overcharging by private hospitals is of course leading to a lot of disturbance, a lot of anger and unhappiness amongst the people.
So earlier, Fatima, you talked about this family, this RSS workers' family who were so upset with Prime Minister Modi. But are they also, not just them, but are people talking about Yogi Adityanath's government? Because in 6 to 8 months' time, there's going to be elections in UP. So what is the sense? What are people saying?
There is this anger, of course, against Chief Minister Adityanath as well. People almost talk about Modi and Adityanath instead of each other, like they use the term synonymously. In UP, wherever we've traveled, we've seen so far, ye Modi Yogi ki government. That's how they refer to the government as. There is this sense of, okay, most people who we met are people who've been diehard BJP supporters since time immemorial, since even well before Adityanath was at his peak of his popularity as he was like a couple of years ago. And so there is this sense of, okay, we worked really hard to bring you into power. We made sure that you come into power, decimating all the regional parties that have existed in Uttar Pradesh for so long. And this is what you do to us. This is how you repay us. So almost there is this personal investment that people had into BJP and into this party. This investment that we don't see with a lot of other political parties. This personal sense of attachment. Even with this person, right? This person felt that, his family felt that, okay, Prime Minister Modi follows him on Twitter, so of course we'll get help. Of course he's invested in our safety and our health and our well-being. So there is almost this sense of betrayal that people are feeling at a very personal level that is hurting them.
निर्मल, आपने जो आगरा में देखा और अभी रास्ते में जो देखा, कुछ और आप बता सकते हैं हमको? आगरा का जो कोविड वाला जो एक्सपीरियंस था, जो लोग क्या कह रहे हैं, जैसे फातिमा ने भी बताया कि बहुत लोगों के अंदर गुस्सा भी है, लेकिन क्या खुलकर ये गुस्सा एक्सप्रेस कर रहे हैं? लोग
खुलकर ये गुस्सा एक्सप्रेस नहीं कर पा रहे, बिकॉज कल हम लोग एसएन हॉस्पिटल में गए थे, वहाँ लोगों से खुलकर बात करने की कोशिश की हमने, बट लोग काफी डरे हुए हैं. लोगों को ऐसा लगता है कि अगर वो किसी जर्नलिस्ट से या किसी मीडिया कर्मी से अगर वो बात करते हैं तो शायद उनके मतलब जो वहाँ रिलेटिव्स है या माता पिता जो भी है जो एडमिटेड है उनको उनके साथ कुछ गड़बड़ कर देगी हॉस्पिटल. तो वैसा तो लोगों का मानना ही है. तो लोग दे डोंट वांट टू स्पीक ऑन माइक, कि उनको है कि आप बात कर लो ऐसे, बट आप ऐसे नहीं. बट लोगों के अंदर बहुत सारा गुस्सा है योगी जी को लेके, मोदी जी को लेके. बहुत ज्यादा वो टर्म ये योगी मोदी यूज करते हैं, और वैसे ही वो बोल रहे हैं कि काफी ज्यादा हम लोगों ने अपना मतलब हम लोगों ने वोट दिया आपको, हम लोगों ने आपको मतलब यहाँ पे लाया है, बट आपने बिल्कुल भी ध्यान नहीं दिया. मतलब लोग ये एकदम डायरेक्टली कह रहे हैं अब तो. और जो निर्मल ये बताइए कि आगरा के अंदर जो एमएलएज हैं, क्या आपने देखा कि या क्या लोग बता रहे हैं कि एमएलएज हमारी मदद करने आए हैं, कि जो बाकी सिर्फ मैं अथॉरिटीज की ऑफिशियल अथॉरिटीज की नहीं बात करें, जो पॉलिटिकल जो इलेक्टेड एमएलएज हैं,
वो क्या कह रहे हैं, वो क्या सामने आ रहे हैं?
अभी तक हम लोगों ने जितने लोगों से बात किया, किसी ने भी ये नहीं कहा कि हमारे किसी एमएलए ने कुछ मदद की है। लोग मतलब खुद लोग अकेले तकलीफ में, लोग अपने रिलेटिव्स को लेकर हॉस्पिटल जा रहे हैं, खुद किसी तरह की छोटी मोटी सोच पैर भी लगा रहे हैं। देन टू पीपल आर वेटिंग इन लाइंस लाइक फॉर 2.5 hours, 3 hours, 5 hours लॉन्ग फॉर गेटिंग अ बेड, नॉट जस्ट फॉर ऑक्सीजन, बस बेड के लिए उतना देर वेट करना पड़ा है लोगों को। तो बाकी अभी तक किसी ने नहीं कहा कि किसी एमएलए ने या किसी लीडर ने उनकी मदद की।
Jyoti, in fact, there was a news that emerged in local papers here the other day that a BJP MLA from nearby Firozabad, he really struggled to get, he was trying to get his wife admitted into Agra's SN hospital that we mentioned earlier, and he failed to. And then he put out a video appeal saying that, please help me, I'm a BJP MLA, but I'm still not being able to get a bed. Finally, he was able to get a bed. So I'm just trying to drive home the point that even a BJP MLA himself was struggling to get a bed. So we can only understand how difficult things are for ordinary people.
Right. Last couple of questions to both of you. Meet is asking, these deaths that you're seeing along your journey, are they counted in the official toll, or how are they being counted?
That is something that we will have to check with the authorities. I'll be honest with you, we'll have to check with them that whether the issue also is that authorities are saying, oh, it's not much. Every day there are like 3-4 bodies. But here only itself, people are like, no. There have been 15-20 bodies on a day. So there is also, the problem of data manipulation of fudging that we've been seeing across various states. It's something that might be occurring here as well. Whereas this clear discrepancy in what the authorities are alleging are the number of bodies in the river and what the villagers are claiming.
Right. And there is a last question from Niharika, and I think you've answered that question actually already. She's asking, is there any disease outbreak post the dumping of the dead bodies? Nirmal, would you like to take this question?
See, there's no some specific disease जिसके बारे में हम लोगों ने अभी तक सुना है, but people are very much afraid कि क्योंकि हर जगह अगर देखेंगे तो it's not just about लाशें, जो आधी अधूरी बॉडियां जो यहाँ जलाई गई है, उसके भी रिमेन्स यहाँ पे सारे आसपास में हर जगह पड़े हुए हैं, बिखरे पड़े हुए हैं. Like when we were like,
कौन जला रहा है बॉडीज को? इन बॉडीज को कौन जला रहा है?
So a lot of bodies are partially burnt before they are dumped. So they are partially burned just so that perhaps for the ritualistic importance of it before they are dumped. Therefore, we are seeing some remains here and there of the burnt bodies.
हाँ, like जैसे हम लोग if like a body takes 3 or 4 hours to burn, like completely get burned. बट यहाँ पे लोग, परिवार वाले इतना समय देना ही नहीं चाहते. वो रिचुअल के नाम पे वो बस अग्नि दे देते हैं, अग्नि के बाद वो पानी में उसे निकाल देते हैं. बट वो जो रिमेन्स बचे रहते हैं वो सारे आसपास में फैले हुए हैं. एंड नॉट ओनली लाइक बॉडी रिमेन, कपड़े, बाल, सब कुछ यहाँ पे आसपास, सब कुछ, मतलब माहौल बहुत खराब है यहाँ का भी फिलहाल.
चलिए, Nirmal and Fatima, stay safe, mask up, be careful, travel safely. Thank you so much for your time.
Thank you. Thanks everyone.
Viewers, you are watching iWitness. This is me, Jyoti Malhotra, in Delhi with Fatima Khan and Nirmal Poddar in Uttar Pradesh. Right now, they are in Hamirpur district on their way to Jhansi, and we will follow them on their journey over the next few days. Thank you all so much for watching.
Thank you.
Thank you.